Mike Gibson here with This Week in Obesity, and I'm joined by two world's experts, Anya Jastreboff and also Darren McGuire. Welcome, you two. Big question. Anya, you had a big trial that you reported on how we can halt the progression from prediabetes to diabetes very effectively. Talk to us about it.
Sure, absolutely. So we just presented the data at Obesity Week in November and also published in the New England Journal. And this was a study that was basically all the participants in SURMOUNT 1 who had prediabetes, which was over 1,000 people. They continued on in the trial and they actually had the opportunity to receive the medication for 176 weeks. So it ended up being over 3 years. And we were looking at both weight maintenance as well as the impact on prevention of diabetes. And what we found was that on average, participants lost up to, on average, 20% of their body weight. It was actually 22.9 with the highest dose. So this is, again, over 3 years. And in terms of prevention of diabetes, there was a risk reduction of 94%. And when we look at the absolute numbers, nearly 99% of people in the tirzepatide treated groups did not develop diabetes. So the number needed to treat was 9. So that means we needed to treat 9 people over the course of 3 years to prevent 1 case of diabetes. And that was really, really impressive. We have not seen that in the diabetes field before.
And Anya, can you remind me, did you have a washout period? I think you did, right? And
Yes, such a good question.
that's
Thank you.
sustained, because it's one thing if a drug that lowers blood glucose, which we found in the DAPA-MI trial with the dapagliflozin. What remains uncertain from that trial is the diabetes reduction, did it sustain after the drug that lowers blood glucose is taken away? So I'd love to hear what you found with them.
Yeah, yeah. So, I mean, and it's such a good question in terms of what happens when we stop the medicine, really for any disease, right? So you give someone an antihypertensive, it works, the blood pressure improves. What happens when we stop it? Do we anticipate that the blood pressure will stay, down? And we don't. We know that we need to continue the medicine, and it's really interesting to think about this. Okay, well, what about here? Because people lost a significant amount of weight, a substantial amount of weight. So what happened is after that 176 weeks, we continued the study for an additional 17 weeks. So just over 4 months off drug. And what we found was that the number of people who developed diabetes nearly doubled. And during that time frame, on average, the weight regain was about 7%. And we saw, increases in systolic and diastolic blood pressure back up to baseline. It didn't reach baseline at that point, right? They had not regained all the weight. But we saw that it was already going back up towards baseline. So, the overall take home is for the medicine to work, it needs to be taken. I think that it also raises this question of what part of the impact in terms of diabetes prevention was the weight reduction versus direct effects of the medicine on the islet. And we had done a post hoc mediation model just to take a look at that. And it looks like just over half was due to the weight reduction, and the remainder was due to other effects of the drug. But we need to do mechanistic studies to really understand that better.
Anya, there were some reports in the lay press this week emanating from some good basic science that your fat cells have memory and that this is genetically programmed. What can you say about that? When you talk about when you stop the drug, you have this genetic memory.
Yeah, I mean, I think it's an interesting question, and it gets to this idea, we get asked a lot, can you reset the defended fat mass or set point? Is that possible? And, at this point, we don't know. We are making an assumption that so far has panned out that obesity is a chronic disease. So once you have an elevated defended fat mass, once your body wants to carry extra energy or extra fat, it's going to want to continue to carry that extra energy or extra fat. But what we don't know is long term and at what time points in your life that is really impacted. So, for example, there are times in our lives that naturally our body wants to carry more fat. One of those is puberty. Another one is pregnancy. So the defended fat mass or set point isn't stagnant. It's mutable, and we want it to be. And so the question is, with any of these treatments, we don't want a fixed set point. We don't want something that is not changeable depending on what our body needs to do and how our body needs to adapt to whatever environment it has. So given that there's these periods of time that are physiologically changing the amount of fat that we want to carry, it may be that we could potentially impact that defended fat mass or set point longer term. And one other thing, I guess, to consider is when we're treating. So what if we do treat before puberty? Or what if a person carries extra fat for 2 years versus 40 years? Right? So I think there's a lot of considerations in terms of when we treat, the duration of treatment, and how that might impact the progression of this chronic disease.
Yeah, it raises a question of primordial prevention and its potential importance. And something I'm interested in, has anyone studied, pound years or BMI years in terms of the cumulative impact of this?
That's such a great question too. In some of the trials, we do have duration of obesity. It is self-reported, so it's participant reported, but I think it's just as important as when we ask about duration of diabetes. Why would we not ask about duration of obesity? And I think, we talk about there are different types of obesities. We just haven't figured out what they are yet, or how to figure out what they are, whether it's genetically or in other ways. But if you develop obesity when you're a child, that's likely a very different type of obesity than if you develop obesity after pregnancy or during menopause. So I think we have to take all that into account when we're trying to sort that out.
Well, Anya, congratulations on your trial, a trial that I think has tremendous, tremendous public health impact. Congratulations. Thanks for your very important work. And thanks to all of you out there for tuning in today.